Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Good morning.
Good morning.
Who are you?
Good morning.
Good morning. Yes.
Ina and I, we jumped through the window and decided to join the show.
Thank
earlier.
you. I saw you flying outside. Superman. I saw you, but I did want to thank you again in front of everybody. We have a lot of listeners from Cure, and I want you to thank you. I thought you were the star of the show, and I'm not telling you that because I just like you so much. I tell you because you really were. You just got this energy. You stood up and you were shaking. I said this morning, you're shaking your booty, and you.
It was a lot of fun.
Yeah, you were good. I never saw
it. Was fun.
You were like you're a real showman.
We got a little bit scared on Claudia because we were trying to find a place. So, but now we know where it is.
Yes, and next year, in April, you'll be there again. But yes, I know
it was fun. It was a lot of fun.
It is a problem about that place.
And the reception from the people,
nice
even
people,
after I finished.
I know it. Yeah.
Yes.
Oh, you got people who came up afterwards? I'll bet they did.
Yes. So it was a lot of fun. Good morning, Ina.
Good morning, Dr. Mencia and Anita.
Yes, good morning. Good morning,
Dobre
Russian.
Dobre utro.
But the point that I was saying to you is, I think that it's rare to find someone like yourself who is so smart when you talk about second opinions. So many people, and you know now, they go to Google and they have a problem. They go and they look it up on the internet, right? Dr. Google. Or they go to one doctor and the doctor only knows certain things, and then they don't give them the opportunity. Well, if this isn't exactly right, why don't you consider this and this before surgery or before things? But you've made it very clear ever since we've had this show, and when you talk, that there are more ways to skin a cat, as they say.
Absolutely. I tell you, I have a young lady, and she came in. I have two ladies. I have a middle-aged lady that came in with a lump in her belly.
A what?
A lump in her belly, right in the abdominal area. And the middle-aged lady, she had it on the left side, right up, left upper quadrant of her abdominal wall. And the young lady had it where the appendix is, on the right lower quadrant of the abdominal wall. The elderly lady, I was very concerned because just examining her, I said, I'm going to do an ultrasound in the office, and the insurance that she has is an HMO. It will not allow my office to do ultrasound. They make it really difficult so the patient don't get the care they need. So I say, I'm going to do it just to test my diagnostic skills. I'm going to do an ultrasound. But I have a hunch that this is a pancreatic cancer.
You didn't tell her that. You told her that?
No, I
told you just thought to yourself.
I'm thinking to myself. And I told her, let's do some blood tests today. And let's work you up. And she's Jehovah's Witness, so they don't take transfusion or anything like that. I said, let me work you up, and we're gonna be very aggressive. Now, at the same time, I'm telling myself it's good that it's located where it is, because the pancreas on the right side of your body is the head of the pancreas, and on the left side of your body is the tail of the pancreas. So if any tumor that is on the head of the pancreas is a killer, it will kill you within months. Anything that is on the tail of the pancreas, the question is how advanced it is. If it's not too advanced, then the chance of survival are significantly much better than having it in the body, or the worst is the head, of course. So I did the ultrasound, and lo and behold, that mass is sitting on the tail of the pancreas. So I got one of my best surgeons, got him on the phone. I say, I need this lady to be seen. I had to run some blood tests. We're going to check, hopefully she's not anemic because, when you do the surgery, of course, you're going to bleed. And then being a Jehovah's Witness, we want to respect her rights of no transfusion. So her blood test was beautiful. You look at her blood test, this lady was not even anemic. Nothing showed that she has pancreatic cancer, except when I ordered the tumor marker for pancreatic cancer. It was there. And we went. I wanted to call the HMO so bad, but I said, let me take care of my patient. So we went on and we got the surgeon. I didn't let the patient leave. I did the pre-op. Usually you send the patient to the surgeon, and then the surgeon will set up a date. Then you come back and get your blood test, your EKG, your chest X-ray. I did all of that the same day. So I'm going to get you through surgery as soon as possible. So the daughter called and she said, I want an oncologist. I want to get an opinion from an oncologist. Of course, I'll get you all of that, but don't delay the surgery. Move on with the surgery. But are we sure? I say, I am certain. And I'm telling you, I'm looking for your well-being of your mom. I want you to trust me. You don't know me. She came to when the patient came to get cleared, she came to meet me. She said, I want to meet you because my mom speaks so highly of you. And I wasn't in agreement with you, but the way she speaks about you, I say, she trusts him so much. I'm going to go and meet the doctor. We got her in. We did the surgery. Of course, we had to take her spleen out and most of the pancreas, but there was no metastasis. Thanks God a million times. Everything was localized, and we were able to remove the mass and save her life.
Amazing.
And she's recuperating, doing well.
Amazing.
And pancreatic cancer, it's like so silent. You don't know you have it. And most insurance will not allow you to get an ultrasound of the pancreas and the liver, unless you have something. That's not preventive. Preventive is do it, and let's see if there is anything we should be concerned about. At least let's do it and let's do something. Let's be proactive and see where we're heading. Do we need to do anything or not? And so we were able to do the surgery, get her through this.
Tell me, wait, before you finish, tell me about the pancreas. I don't know very much about the pancreas.
Well, the pancreas is an organ that it produces insulin. It's one of the functions it has. So it's part of your digestive system. So when you eat food, right, you have starches that go through your diet and sweet and stuff like that. And the food, once they get processed, the sugar that your body needs, for example, your brain, that sugar need to be processed. If you exercise, you're going to use that sugar to create energy. So every time you move a muscle, imagine a lot of people working in a factory when you're moving a muscle. So every time a muscle moves, when you walk, when you take a step, when your heart make a contraction, all of those muscles, they need energy. And that energy will come from sugar. The brain, the main source of fuel is sugar. The problem is when you have too much sugar, then instead of going in, if you don't have insulin, if you have a diabetic person, is a person whose pancreas is not working properly and doesn't produce the insulin that they need. Also, it have to do with the digestion. So when you eat, some people have to take pancreatic enzymes because their body, the pancreas, shut down and will not produce the enzyme that they need to digest the food.
Well, let's take some steps back. Let's say that you were not the doctor when the woman came in with that lump, right? What would one doctor think, and what would they probably do typically?
Well, see, this a doctor in a walking
Clinic.
one of those walking clinic. I call them the drive-through clinic.
Drive-through clinic, okay?
they, they might know more about your spare tire than your than your body. So she said, the doctor told me what I have is a lipoma. Now, a person, you see a lot of people with lipoma on their back, on the forearm, and it's an accumulation of fat. And it did make sense when you see it. It could be look as a lipoma, except when if you grab it like I did, and I told her just lay down flat and bend both of your knee. And the reason you do that is because now the abdominal wall, all those muscles in here, just relaxes. So she lay down flat in the exam table. On the exam table, bend the knee, and then I was able to grab that mass. And as I moved the mass, I said, the spleen is coming this way when I pull. When I pull, I see her belly moving this way. I say, this is attached to something. And knowing the anatomy, I say it have to be the pancreas. The only thing that is on this area were two things, the stomach and the pancreas. But out of these two, if you have a mass like that attached to the stomach, 90% of the time they are benign. But if it's attached to the pancreas, we have to move.
Okay, but you said that the HMO would not allow you. Now, why is that?
Because HMO is a business.
Yes.
That's what people need to understand. When you take your Medicare and give it to an HMO, Medicare, the government, have to give them X amount of money. And it's like when a doctor becomes capitated. They offer me, Dr. Mencia, you want to be capitated. Capitated means for every life that I treat from that insurance, I'm going to get, let's say, $2,000 a month. So imagine if I have 100, 500 life from the insurance, I'm getting all that money coming to me every month, whether I see you or not. So the question is, if I'm going after the money, why would I want to see you?
Exactly. I see.
Why do I want to see you? Because I'm making all that money. I don't need to see you anymore.
And that's against your philosophy.
And exactly. And if I do blood test on you, it comes out of my pocket.
Yeah.
Why do I want to do blood tests? If I do that ultrasound, I'm going to have to pay for it. If I call a consultant and I'm going to send you to one of the best consultants, and that consultant is out of network, and I decided that you're going to see that consultant, it's coming out of pocket.
I see.
So
that's why they,
so HMO is basically the same way. That's how they make money. They get X amount of money from the government, from Medicare, let's say. If it's, let's call it $2,000, like the doctor. If they get more. They get $10,000 they get. If they give you all generic prescription, and they don't send you to see doctor. They don't allow you to get an ultrasound. They don't give you dental coverage except cleaning, but nothing else but cleaning. Extraction come out of your pocket. At the end of the month, they end up with a benefit staying with them. And
so in essence, what happens, I do understand. So that, but you, of course, felt that it was something different. And I want to go back to the second opinion.
Yeah, and this is a patient that's been with me for over 10 years.
Yeah,
I'm not I wasn't gonna let the HMO take.
But you knew something. See, then that's what I said to you, that I have known you a long time, and I have always felt from watching you that you really do have the word is a knack, K-N-A-C-K, a knack for understanding people, knowing them. And because I've brought people to you just as on a fluke, when they go to other doctors. No, you have to come down to see Dr. Mencia. I want you to see him. And it's something about you, and I don't think you can learn it. I think it's innate, and I think you have this. So I would like to suggest, because you have so many listeners, that if someone has a serious, well, they don't even know it's a serious problem. You have a problem, go to your doctor. If it isn't Dr. Mencia, which is foolish if you're not going to Dr. Mencia, but if you have a problem, you should come and let Dr. Mencia just attest that, yes, he thinks that's right, or no, consider this. Because it could be life-saving, as you've just explained with this.
One of the listeners, he passed away not too long ago. He was the founding father of Motorola in Israel. So he was very well off. And his wife was the one that said, I listened to this doctor on the show. Why don't we just go and take a look at it? Let's go and see him. And he will go and travel to Texas and get people, whoever they go to Dr. Google first.
Yeah, Dr. Google.
Okay, let's go and see that guy. That guy sounds very interesting. And then we just fly over and get all kind of tests done and get put on different things. And when he came to me on the first visit, I made the diagnosis on him. And it was just me, my stethoscope, and listening to him talk, watching his veins in the neck, the way they were distending. And when he finished, I said, I want to listen to your heart before we do anything. And I listened to the heart. I said, let me finish my physical, but I want to do an echo before you go anywhere. And he said, oh, Dr. Mencia, you are a mensch. Look, look how you treating me. You're treating me like a king over here. So how much I have to pay beside and he had good insurance, Medicare and very good AARP, he had really good insurance. So you don't have to pay anything. Your insurance covers everything I'm doing. So I thought that was the trick. I thought you were going to charge me at the end. I said, no. So after that, I said, you have a problem with the valve of your heart. And we have to get it fixed. So we put him in the hospital. We took care of the valve. In 2 weeks, the guy was back playing tennis. He was 93, something like that, when he passed away. In 2 weeks, he was back playing tennis. And he was so grateful. He would come, even though if the Boynton office was already open, he would come to Fort Lauderdale and I will only see Dr. Mencia.
Of course.
And the poor wife, the wife, he would say, like, if he was a little constipated or something was going on, he would tell the wife, okay, let's get in the car and see Dr. Mencia. But you saw him yesterday. I don't care. I want to see. So the poor lady will get in the car. She's such a sweetheart. She will get in the car and drive him all the way down there and say, but you're okay. I just wanted you to see me and just tell me that it was okay.
I feel the same way. I understand how. Well, I'm going to tell everybody how to get in touch with you. We do this and they say, so how do you get in touch with this man? Okay, Dr. Mencia. He is the founder of AGI Medical and Dental Centers. Started in Fort Lauderdale, has been there many years, and now he's expanded to Boynton Beach. But they are open on Saturdays. He rushes right out of here every Saturday morning at 7:30, and he's there at 8 o'clock for his patients, dressed like a king. At 1608 East Commercial Boulevard in Fort Lauderdale, and the phone number there is 954-489-1345, 954-489-1345. And if you're interested in Boynton Beach, I don't want to have to ask you, are they open?
They're dental.
So you've got everybody trained now. Everybody's open on Saturday, right? Oh, my goodness. Okay, so and also it's very important to let everybody know home visit services are available for homebound patients. That's one of the finest things that Dr. Mencia has really created, because when you're sick and you can't get out from your home, nobody cares about you. You can't get them, but you can get the AGI. They will take care of it. So let's go back now to the second opinions.
So that was that lady. Let's talk about the young lady. Remember, there was a young lady too.
How old was the lady with the pancreatic
It was
cancer?
52.
Okay.
52. The young lady, she's probably 35. Right? Probably, mid-30s. Young girl, no kids. Very successful young woman. She used to have a company that sell cruises. And I think it was American Express bought it for her for a few $1 million.
She sold what?
Cruises. She used to sell cruises.
Vacation cruises. I'm sorry.
And
cruises.
stuff.
Okay.
And
cruises, right.
she sold it for millions of dollars, and she was very well off, young woman. And she came in with a lump on the area of the appendix, on the right lower part of the abdomen, of the abdominal wall. So of course, you get concerned, so young. So her father was my patient. So I know her father didn't have colon cancer, the first thing you think of, but I didn't know her mother that well. So I asked her about mom, say no, family history. She wasn't too sure. Let's do an ultrasound. And this lump, it didn't look good, didn't look right. Let's do an ultrasound, but let's do some tumor marker. So I rushed the tumor marker. Now, she was about to go to Europe on vacation. Mm-hmm. So I said, I have to get everything done before you go anywhere. So we ran all the tumor marker. Everything came back negative. Everything came back normal. Thank God. So I sent her to a very good surgeon. They were a partner of the one that did the 52-year-old lady. A partner. I said, this guy is really, really good. And you being so young, I want him to be there because he's very aggressive and he'll do the right thing for us. She came back and he went and he said, yeah, we need to go in there and your Dr. Mencia already did the CAT scan. He did everything. We need to go in there and get this thing and find out what it is, but we don't know what it is. So I also sent her to one of my gastroenterologists, one of my best gastroenterologists, beautiful bedside manner, very good guy. And the gastroenterologist said, we have to scope you. You're still young, but we have to put the scope down and see what's going on, take a look. Because we really don't know. The CAT scan doesn't specify really what's going on. Or Dr. Mencia ultrasound just show that there is something there, but we don't know what it is. So the poor girl is like,
Of course.
So she come to me, what do I do?
Right.
I say, if you were my wife, I will tell you, let's go on vacation, enjoy yourself. There's nothing to worry about. When you come back, I will have everything in place for you.
Fantastic. Can you believe that?
So she went on her vacation. She came back, and we're getting everything set up for her to go in. But when she came back to see me, she said, I really don't want to see that surgeon. I said, why? Because I asked him about the colonoscopy. And he said, no, you have to talk that with Dr. Sacco, the GI doctor. And he's not like you. You can talk to me about GI. You can talk to me about surgery. You can talk to me about... I say, he's a specialist. And sometimes specialists, they live in their own little world, but that doesn't make them bad people. But, just the way they answer is they don't know GI. Now, if I would have sent you to a colorectal surgeon, those people, they do colonoscopy themselves. So he probably could have said something, but not the one I sent you to. But I'm sending you to somebody that has very good hands. So she said, okay, in that case, I guess I stick, with him. And say, if you have questions, come to me. I'll answer.
Did you have a feeling about what was wrong with her before? Even though you had all those tests inside, did you worry about something?
Well, when you have a mass in the colon, in the large intestine, see, when the large intestine are responsible for making the poop, and the way the poop are formed is start liquid, like water. So the right side of the colon deal with the liquid poop, and the left side deal with the hard poop.
I love you. Only this doctor would do this. I mean, this is a poop show now. Usually it's a sex show. Today it's the poop show. Okay, keep going.
So what happened, if you have a mass on the right side, because it's liquid can just move around the mass. So you can have a huge tumor on the right side, and you will never know until you feel it. But on the left side, you will know right away because you will get constipated because the hard poop cannot go through, where the liquid poop can move on the right side and everybody is happy-go-lucky. But looking at the location, I told her, it looked like most likely a benign tumor that you have there, something benign. And it's not part of the large intestine, but it's part of the tissue that holds the large intestine in place. And we have seen that, those kind of tumors. If you let them grow, they can kill you. But a lot of times they are very benign. You just go in there, dissect them, pull that out, and everybody go home. So
You felt that with this.
and I'll keep you abreast of what's going on. But she went on her vacation, sent a lot of pictures, and, she came back. She's so happy she went on vacation. She went to Belgium, Italy, and Germany. 3 countries she went to with her husband, and they have a lot of fun.
And the poop show will continue after the news.
After the news. Take it away, Richard.
Well, no, I know about you and poop because you did that with my husband. I mean, I love that when we said that, right?
Yeah.
About you being, that was so funny. But it's true. But we all feel that way. Well, we'll be right back. Just stay with us. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.